it's Kelly, and welcome back to room 9 3/4. Today we are going to be talking about restraints. So we keep several different restraints within our department. The soft restraints, as we call them, or these, will be kept in the EXI closet as well as room 9. And then our Velcro restraints as well as our chest strap will be all stored in the EXI closet. So in terms of, just before we get started, documentation-wise, any of these restraints can be used for medical purposes. So if you're a patient that's intubated or is not doing well with these soft restraints or is breaking them or something like that, you can move on to the Velcro restraints and document those as medical needs. Just because they are in these Velcros does not mean you have to document them as violent restraints. Again, if that is the indication for them, then you should do that. You should follow the policy. You should do the face-to-face. You should do the 15-minute checks. But again, if you are using these as a medical purpose restraint, then you need to follow the medical policy in terms of documentation every 2 hours. Make sure that you have your orders in, all of that good stuff. So RNs are allowed to place restraints without an order technically at first if the patient is in direct issue with harming themselves or staff or anything like that, but then you will need that provider order afterwards. So please make sure that you are documenting your restraints correctly, what you are using them for, the orders, everything like that. But we'll just be going over today some tips and tricks, and then at the end of the video, I'll be showing you how to apply these onto your patient. So again, just a quick reminder, all of these need to be, in terms of the bed, placed on a non-movable part of the bed. So you don't want to be tying these to a rail or something like that. So again, non-movable part of the bed. So for our soft restraints here, we have the new clip ones. This is how you will attach it to the bed. So this part will come off. You will slip whatever you're attaching it to around here, and then you're just going to pull this through the hole. So the part of the bed that you've attached it to will be between that. That is how you're going to attach it again to a non-movable part of the bed. Now, getting into placing it on your patient's wrist, you want to undo this here. You want to put this around your patient's wrist. And when you are placing this around your patient's wrist, you want to be able to ensure that you're able to stick a finger or two under it so that you're not hurting the circulation of your patient or the muscles surrounding that wrist. So make sure that there is some space there. And then just a trick here. So you'll want to obviously clip this restraint in to keep it in place. What you can do with this clip is, once you tightened it down and figured out, again, after you tighten it, you still want to be able to fit that finger in there, figured out where you need to put it, you can flip this side of the clip around backwards here and clip it in like this. This kind of just makes it harder to tug and pull and loosen this. The other thing is the end of this clip is Velcro, so you want to Velcro it down to the wrist restraint here. And that's just so patients aren't able to reach it, grab it, pull it loose, or anything like that. So that is going to be your placement of your wrist part. And then this is the part that will clip into the part that's connected to the bed. So you will clip this in here, and then you will tighten it to wherever you need to so that the patient is unable to reach up and grab their ET tube or whatever, again, that they are interfering with their medical care. After you clip this in, you do want to tie a slip knot, and that is, again, to just help prevent any loosening of the restraint. So again, you'll just want to tie a little slip knot in there so that they're not able to pull and loosen this restraint. So that is how you will tie on your soft restraints. And again, at the end of the video, I will show you on an actual person. So that is our soft restraint. These are our Velcro restraints. We'll go through each of these. The red one is going to be for the ankle of your patient if you need to strap, again, the ankle of your patient down. take this off. On these, the big thing to remember is, again, these are red and black straps, and you're going to connect the black strap to the black, the red strap to the red. So when you open it up, it'll look like this. This, again, is the part, this larger part here, is the part you need to attach to a non-movable part of the bed, so usually the end of the bed. So we will wrap this around whatever non-movable part of the bed we're doing. Black Velcro, so soft and Velcro part, and then you'll have your red that overfills it, and then your red strap to do it. This will be your ankle part. So you'll open it here. You will stick this around the patient's ankle. Again, black strap to black strap, red strap to red strap. And then again, you want to make sure that there is room in here so that you're not cutting off any circulation or damaging any of that area of your patient. For the blues are for the patient's wrist. And they also have clips. Some of them have D-rings, but we are going to go over the clip ones today. So this is the part that will be, again, against the non-movable part of the bed. This clip is a little different. It's got 3 places that you need to press. So we'll press all 3 of those. And then maybe I will get it off. There we go. So again, you got to press, I don't know if you can see that too well, but this button as well as these 2 on the side. So again, this you will wrap around to the non-movable part of the bed. Once you have, again, tightened it, you again want to tie a slip knot into this back half so that they are not able to pull up on that and try to loosen that. Again, this slip knot needs to be something that you can just one tie off. So that is what you want to do to that part. To the wrist part, again, they are blue, so you want to go blue to blue and black to black. So we will undo this here. So your patient's wrist, this will go around the wrist. It'll just sit in here. You will attach the black strap to the black strap, and then blue strap to the blue strap. Again, you want to make sure that there's some room in there. And then again, with your clip, once you have figured out where it needs to be, you can also flip this. So this is how it would usually clip in. You can flip this and clip it to kind of help prevent any kind of pulling or tugging on this. You can also tie, this does not have a Velcro piece like the soft restraints do, so you can also tie a little slip knot in this as well to help prevent any pulling or loosening from your patient. So after you do that, that will be, again, double check that you got some room in there, and that'll be how you put on your Velcro restraint. Usually during this process, security might be at bedside helping you control the patient, especially if they're being violent or combative or interfering with any medical care. So they also might be there to help you as well. Put those on your patient's wrists and ankles. The other restraint that we also keep down in the ER is called a chest strap. So this is what that looks like here. So it is, again, a large chest strap. So this will be placed along your patient's chest. Again, you want to make sure that this is kind of low and tight. So this is basically for use of patients that are harming themselves by like throwing themselves back into the bed or things like that. We obviously don't want anyone to injure themselves while they're in our care. So this is just something else that we can use. It'll go right across their chest. And then what you want to do is you want to tie these to a non-movable part of the bed using the slip knot technique that you have tied all your other restraints with. Again, when you do that slip knot, you want it to be a one-pull release just in case anything emergent happens and you need to get it off. But this is the chest strap. Again, all of these restraints need a licensed provider order. They also need, again, whether they are for interference with medical care or whether you are doing them for violent purposes. And that will determine your documentation moving forward. All the documentation will be in iView, in Cerner, and FirstNet. Again, make sure that your order is in correctly. Make sure that there is room between the cuff and the patient. And other than that, stick around and I will show you how to place these on a live person. Hey everyone, it's Kelly and we're back to put restraints on our live patient here. So we're going to do the soft restraints first. On our stretchers, we have a little kind of rectangular bracket down here that is non-movable. That is where you're going to tie a majority of your restraints. Again, don't want to tie it to a rail or anything like that. You want to tie it to a non-movable part of the bed. So you will put your restraint on your patient's wrist, as so. Again, you want to make sure that there's room to fit a finger in there, and then you will strap it after you tighten it. Again, this is the part where you can flip the clip so that they can't pull against it, and then you want to Velcro this piece down to your wrist restraint. Then you're going to unclip your bottom part of your restraint, put it around the non-movable part of your bed through this little loop down here like I showed you in the beginning part of the video. And then once that is secured to the bed, you will clip your patient's restraint in. Again, place the arm where you want it on the bed, tighten this part of the restraint, and then tie your slip knot into the restraint so that they are unable to pull against the restraint. Okay, so now you're going to put on your Velcro restraints. Again, just like your soft restraints, you are going to place your patient's wrist in the loop here, and black strap to black strap, and then overlap with your blue strap to blue strap. Again, with your clip, once you've determined how tight it needs to be, you can flip the clip and clip it into your restraint. Again, this one does not have the Velcro strap, so you can tie a slip knot here if you need to. And also, again, make sure you can fit a finger in between your patient and the restraint. And then, just like on your soft restraint, you are going to loop this through a non-movable part of the bed. Again, I'm choosing to use this bracket down here on the stretcher. And then, once you pull that through, you will clip to your restraint, and then again, tighten to where you need it on the bed here, and then tie your slip knot through that. And that is how you're going to put on your Velcro restraints. Okay, so now we are going to do your Velcro ankle restraints. For these, especially if you have a shorter person, I recommend using this area of the bed. It is a non-movable part, and it just makes it easier for you to get to the patient's ankle. So again, we will do these straps. Again, you want to do black on black, red on red. You will slip this through here, part this part of the strap down, and then your red part of the strap down. That is going to anchor it to the bed for you, and then your patient's ankle will go in this part. So we will open this up here, and you will place your patient's ankle within the strap. Again, black side first, and then your red side. And then that is all you are going to want to do, and you just want to check again that you have some extra room here so that you're not damaging any of the areas, and then the patient should be unable to kick or anything like that with this restraint on. Okay, so another thing that we wanted to discuss with our restraints as well are these are the other blue Velcro restraints we carry. Again, very similar to the clip ones that you saw a little earlier in the video, except these have D-rings on them. So again, you will place your patient's wrist in these restraints the exact same way. So black strap to black strap, blue strap to blue strap. But then once you come over, instead of clipping it, you're going to go through the D-ring. So you'll want to go through both D-rings first, and then back through only one of the D-rings here. So like this. And then once you get to the end, in order to keep your patient from pulling and tightening this, you will want to put a slip knot In this part of the D-ring, sorry, I'm fumbling a little bit, so that they don't pull this any tighter. And then for these, you will attach this to, again, two non-movable parts of the bed, the exact same way that you did that D-ring. So you will slip this around the non-movable part of the bed, come through both D-rings until you need to slip through one D-ring, tighten it to secure it to that non-movable part of the bed, and then again tie your slip knot through there so that your patient isn't able to pull this any tighter. Big difference in this is that you will tie this to two non-movable parts of the bed. So one can be that lower bracket that we were tying earlier in the video, and then one can be somewhere on the upper part of the bed, but they will kind of be on a lower part and upper part of the bed so that you kind of meet your wrist strap in the middle where your patient's wrist will be in the bed. So just so you're aware, both of these straps work the exact same way. It's just the difference between the D-rings and the clips. So you might see either one of those out on the floor. Thank you for watching our video on restraints. If you ever have any questions, please feel free to ask someone more experienced around you, or ask us, or if you're in the moment. All of these restraints do come with instructions inside the box, so you can use those as well. Again, if you are placing restraints prior to an order, please make sure that you get that order from a provider and that you are documenting correctly on your restraints. We'll see you next time on Room 9 3/4.